So good afternoon, everyone, and thank you so much for joining us for one of our YHARC Yorkshire Humber Lunch and Learns. And today we've got Sally with us, who's my fabulous colleague and the programme manager for the NIHR Applied Research Collaboration Yorkshire Humber. And Sally's going to explain to us all about the YHARC and what it is and what we do. Like I said, it will be recorded, so you can share it with your colleagues, and that'll be on our YouTube channel, which I will provide the link for. And I've also put the link for our YHARC newsletter in the chat as well. So you can sign up for that while you're listening. So over to you, Sally.
Great, thank you. Lovely to see everybody. Well, I say see everybody, I can't see anybody. Oh gosh, my desk just flew down a notch. Sorry, everyone. I can't see anybody on screen just now because I'm sharing my slides. But I could see you all joining, and it's great to see you. The idea of today, if you haven't been to one of our lunch and learns today, it's quite informal. You know, I'll present this in a relatively informal fashion, and try and leave lots and lots of time at the end for us to have a bit of a discussion, or for you to pick up on key points, or to ask me questions, because it's a reasonably tall order to cover. What's an YHARC? What do we do, and how do we get involved in about half an hour, but I'll do my best. So my name's Sally Bridges. I manage the YHARC in Yorkshire and Humber, and some of you, I recognise lots of your names as you were joining the call. Some of you, I think, will know a lot about the YHARC. Some of you will know a little bit about the YHARC, and some of you may never have really engaged with the YHARC and don't know very much about it. So hopefully there's something in today's presentation for everybody. And the YHARC isn't something new. It's a legacy. It follows a legacy of something called CLARCs, which were collaborations for leadership in health and care research. I think probably now they started about 15 years ago. So we're building on this, really strong foundation of applied research collaborations in our region. Across time, and we're learning as we go, as we all should do, iterate and improve as we go. So I'm going to start. Oh gosh, I say I'm going to start. Nothing happened there. Let's see. Forgot to check that the slides actually moved. Let's see if it will move.
Sometimes it's just getting them going. Yeah, perfect.
Brilliant. Okay. So just to start with, an YHARC really at its heart is a local partnership. So YHARC stands for the Applied Research Collaboration. There's sort of 3 clues in there. It's about research. The research must be applied. It's not, scientific laboratory-based research. It's in real life with real people or real workplaces or practices around health and care. And then that final letter in the acronym, the C, is the collaboration. And that collaboration is sort of central to everything that we do. And the collaboration is really a local partnership. And when we say local, for us, we mean Yorkshire and Humber. And it's really about designing applied health research, health and care research that meets the needs of that local population and the health and care systems within that population. There is an YHARC in every area of England, so there are 15 YHARCs, and the collaboration or partnership locally tends to be between NHS providers, university colleagues, charities, local authorities, the health innovation networks, which used to be called the Applied Health Science Networks, AHSNs, and other organisations. And they all come together. Those other organisations might be industry partners, for example. And we're all coming together with this common goal of doing really good quality applied healthcare research that meets the needs of those local population. And really, I think if you had to sum up what we do in one sentence, our aim is to speed up the translation of research into practice. So it's not just about doing research, it's about making sure that what we find from that research is applied into real life so that those benefits can be experienced as quickly as possible. And the current funding runs until March 2026. There's an anticipation that there'll be another round of funding, and hopefully we'll hear about that later on this year. So that's what the YHARCs are. Loosely, they're funded by the NIHR, that's the National Institute for Health Research, and it's what NIHR call their infrastructure offer. Infrastructure covers all sorts of different things, so things like the Clinical Research Network, the Research Design Service, or the Research Support Service as it's called now, things like the Biological Research Centres, the MedTech and In Vitro Centres, and it's basically an end-to-end piece of research infrastructure supporting everything from sort of design and concept through to applied and implementation-based research. And we sit at that sort of end there, that sort of more translation piece of research. But every ARC is different. So because it's designed to meet the needs of local populations, every ARC has been designed slightly differently in collaboration with the local partners. So here's the aims of our Yorkshire and Humber ARC. So we've got 6 aims here. So we aim to advance knowledge and support change. That's all about you know, adding to that body of literature, making sure we understand what works for people, what works well, and particularly doing that through equalities lens, I suppose, or an equity lens. So we're understanding that not everything works in the same way for everybody, that certain things might improve things for some people, but might actually make them worse for others. So always having that equity focus to the work that we do is really important for us. And then crucially, the second part of that aim is to support change. We're not just doing it to advance knowledge. We want to do something with that knowledge. We want to change things and make them better. Our second aim is to encourage these research collaborations, and that's regionally in the first instance, but also nationally. So for us, from an applied perspective, good quality research collaborations that meet the needs of the population need to involve lots of different people. It's highly unlikely that a researcher sitting on their own will know exactly the right question that the service needs, the health and care service, or exactly what participants or members of the public think is important for their own lives. So you need that collaboration that brings together all of the right people to make sure we're asking the right questions, we're answering them in the right way, and that we're able to then put into practice those findings from those research projects. We want to improve services and health outcomes and reduce those health inequalities, as I mentioned, through research. So constantly taking that equity-based focus through the work that we do. And a big part of that is co-producing research with practitioners and the public. You know, as I say, the clue's in the name, the collaboration piece, but it's at the heart of everything that we have to do. And it makes our work higher quality as a result, and more likely to lead to changes that are going to improve people's health and well-being. But we also want to focus on developing innovative methods for applied health research. So, you know, whether that's looking at things like the possibilities that exist with AI, or it's about developing new simulation models for health economics. We do all sorts of different things to help us to design the best quality health research in our region. And that's drawing on the best minds, so building those strong collaborations. And then the final point here is about building researcher capacity. So a big part of the goal of the ARC is not just to, you know, we don't take the funding from the infrastructure and keep it all in the place where it lands. It's about using some of that funding to help everybody to develop their research capacity, so that the capacity is there within the system at all different levels, whether that's at an individual level, a service or pathway level, or at that system level, so that everybody can be part of research, because it will take us all, if we're going to use the findings, you know, to design the right questions, to answer the right questions in the right way, and to make use of what we find. So there are aims in Yorkshire and Humber. And just to give you a bit of a sort of idea of scale, I suppose, and some of our highlights, we so far in the current ARC contract, so that's this is about 3.5 years worth of data, we have supported 296 individual research projects. Those projects can range from very small projects that might be, say, some qualitative interviews and focus groups around, let's say, perinatal mental health, which we did for the West Yorkshire ICS, or up to something as enormous as the Born in Bradford research programme, which follows the lives of 50,000 people across the whole of Bradford and is a world-leading piece of research. So they're really varying in scale and size, and that's to do with that responsive idea, that, you know, doing what we need to do for what the system needs, and the academic outputs, and generating that knowledge for change. So yeah, 296 projects have been supported so far. From those 296 projects, we've had 168 publications. So that tends to be, when we're counting publications here, it's one of the key outputs that NIHR asks us to count. So that's things like journal articles. But we know that journal articles aren't the way to communicate with everybody. So as well as that, Kate, who introduced me on the call today, leads a comms work stream for us, where we look at trying to make sure that we're reaching everybody in different ways. So whether that's through our newsletters and websites, or through policy briefs, or face-to-face events with members of the public, or colleagues in voluntary sector organisations and local authorities. A big part of what we do is work together in our collaborations to design these research ideas and then apply for external funding. So it might be, trying to think of a recent example. There was a study that looked at a trial about how you might reduce loneliness for older people, basically adapting sort of CBT methodology in a phone call based program. It was something that was discussed from both an academic perspective and a practice perspective out of Tees and Wear Valley colleagues. And, you know, together there was a collaborative application that went into NIHR that leveraged some funding that enabled that team to go ahead and do that research. Because the funding that comes from NIHR for this is the collaboration, it's the infrastructure. It's not the money to do all of the research, it's the money to bring everybody together, to convene everyone, and to get that conversation going about what the questions are and the work that we should do to improve things into our system. So over the course of the 3.5 years, we've leveraged about £62 million in external income. We, you know, I've mentioned lots and lots of times about the importance of our collaboration, and one of the ways that we measure that is in co-funding. So all of the co-funding in this calculation, almost all of it, is co-funding in time. So it's recognising the value of people's time that they put into this collaboration and trying to estimate a value of that. And so far in those 3.5 years, across the partners that we've had involved in Yorkshire and Humber, that's come to around £6.8 million. We've supported 72 PhD students. They're all at different stages. Some of them are just starting, lots of them are finished now, which is fantastic. And our YHARC supports them through their studies, through the provision of supervisors, funding for their awards, and providing opportunities for them to develop and train in the way that they need to succeed in their project, but also support to make sure we're sharing findings back out into the system. There's been, over the course of that 3.5 years, 122 different staff have worked on YHARC-based projects, and we have recruited more than 50,000 participants into the studies, those 296 projects that we're talking about. Over 50,000 participants have taken part in those 3.5 years. So that gives you some idea of scale, and I've mentioned our partners, and here's a lovely busy slide, I think, with all of our partners on, or our members. Sorry, I use the words members and partners interchangeably, really, for no other reason that I'm inconsistent. It doesn't mean anything different. We work together, and they're, you know, these partners, our members, are integral to our success and our collaboration. And anybody is very welcome to apply to be a member. If you don't see your organisation there and you would like to become a member, then just get in touch and we can talk about that. We ask you to talk. We ask for a little bit of information about you know, why you want to get involved and how you think we can work together. And if your interests align with ours, we're really happy to welcome you as members. And I've got a slide at the end which talks about getting involved and the different things that that offers. So thinking about the way that we structure our YHARC, as I've mentioned, all of the YHARCs are different nationally, and one of the ways in which they're different is the focus of research that they work on. So these are our themes of research in Yorkshire and Humber. So we've got older people, healthy families, mental health and urgent care. So our older people topic tends to focus around older people with frailty. Urgent care tends to be around conveyance by ambulance to hospital and trying to ease pressures in that space and you know, reduce avoidable admissions to hospital. Mental health tends to be a focus around mental and physical multimorbidity. And then our healthy families work is around the early life period, and particularly taking a prevention-based approach there. So, you know, very much a public health focus into how we can help families be happy and healthy. And in terms of where these are led, we're academically led from across the region. So our older people with frailty theme is led by Andy Clegg, who's at the University of Leeds and works clinically here at Bradford. Our urgent care theme is led by Suzanne Mason, who's at University of Sheffield at YHARC and works clinically out of Barnsley Hospital. The mental and physical multimorbidity theme is jointly led by Simon Gilbody at York and Scott Weish at Sheffield. And our healthy families theme is led by Rosie McEachen at Bradford and Kate Pickett at York. So we've got a mix of people involved, a mix of geography involved, and a mix of topics. And we didn't just pick those topics out of the air. These topics came from a detailed consultation with partners before we submitted the current application to NIHR. And these were the 4 topics that came out as key to include in our ARC. And then you see around the tree, we've got some topics sort of wrapped around, and they're what we call our cross-cutting themes. So working together with those sort of topic areas, if you like, we have health economics, evaluation, and equality to make sure we're bringing you know, the best academic rigor to those methods, and innovation, like I mentioned, you know, always looking at new and interesting methods to improve the work that we do. And then that second cross-cutting theme is improvement science, so bringing all of those techniques to these substantive areas. And then on the left here, we talk about involvement and collaboration with the public. It's a really central theme for us. We've got a leadership team who helps us to ensure that we're doing this across the ARC. We've got a strategy that informs that, but actually the work of PPIE, our patient and public involvement and engagement, is embedded across the whole ARC in all of those themes, and we would expect to see it on all projects within the ARC. And then on the right-hand side there, we talk about working together with our implementation theme to make sure that the research is translated into practice. And in order to do that, we work with the Improvement Academy in Yorkshire and Humber, who are a team that are really experienced in frontline practice, working with frontline practitioners to actually make change to the way that things are done and delivered. So they've got real skill in understanding how you take something that you know works from a research perspective, or you think works from a research perspective based on your best available evidence, and then actually implementing it in, you know, a busy practice or in a particular care pathway for people. So that's our themes. But in terms of what we do, I'd say those themes sort of live in this blue bubble in the middle. It's all about, this blue bubble is all about mobilising research to tackle inequalities and improve health and wellbeing of communities. But around the outside here, I'd say this is the sort of other stuff that we do that maybe people don't know as much about. So I've mentioned the sort of partnerships and co-production piece. So this is really our sort of role in sort of connecting and convening applied health research and practice across the Yorkshire and Humber. And that's for individuals, organisations, network systems, partnerships. So, for example, we bring together a group of individuals who are interested in applying for PhDs. So they're at an individual level, we're bringing together a partnership, and we're talking to them about how they might develop in their academic career development route. Similarly, we've got a group called the Copper Network, which is a co-production network, which is all about bringing community-based sort of peer supporters, peer researchers, together to actually co-produce research ideas. So there's all sorts of different things happening at an individual level, but then at a partnership level, we've got something called our ACORN group, which is a group of mainly research and development managers from within NHS organisations, and it's Addressing Capacity to Do Research Network. That's what that stands for. And that's a partnership or a peer support group that talk about how we can share across, share best practice across the system and how we can work together on that. And then at a system level, we work with our ICB partners. So the ARC is the research lead for the ICS, the Integrated Care System in Yorkshire and in West Yorkshire, and then we work closely with Humber and North Yorkshire and with South Yorkshire to make sure that we're linking in at those stages. So we're a bit like the glue that sticks things together. And you know, on another level, it might be that, you know, a clinician's got a great idea for something, and really is keen for it to be evaluated and shared more widely, and they might come to us and say, "I've got this great idea, don't know where to go from here," and we might put them in touch with an interested academic partner from the region who can then help them to take that forward. So yeah, a bit of that sort of system glue and system convener. And then moving on to the sort of grey box there about learning and development, something that sort of sits around everything is that learning and development at those different levels. So, you know, you're here today learning about the YHARC. That's because we've got this, you know, Lunch and Learn series out there helping to talk about all sorts of things, from what is an YHARC to introducing theories of change, to how to implement, to what does an equality impact assessment look like and why is it important. So a whole host of different learning and development opportunities. So that's the sort of more general offer, but then there's really specific learning and development routes through the YHARC, whether that's applying for a PhD, or it's and you know, being mentored and supervised through the YHARC, or whether it's, you know, you're working in a local authority and want to develop a I was going to use an acronym, PLAF, and I can't remember what that actually stands for. Practitioner Local Authority Fellowship, I think it stands for. And I'll talk a little bit more about all of those things. So a little bit of it is sort of demystifying what's all out there. You know, if you're interested in learning and development from a research perspective, you can come to us and, you know, and hopefully we can help. We've got lots of experience and assets around connected data and cohort infrastructure, and we use that to drive that work in the middle, you know, to mobilize that research. It might be that we use connected data to look at where the greatest need is. So, for example, we had a dental project, a pediatric dental project, and rather than our researchers or clinicians working with people that they always work with, they came and said, do we have any connected data that might help us to understand where the greatest need is? And so they ended up forging new relationships and targeting the work in a place that they hadn't worked before, but where the data told us actually there was the greatest need. And our cohort infrastructure sits across all of those themes that I mentioned. So we've got an older people's cohort in Care 75 Plus, it's called. We've got the Born and Bred in network, which is a mother and baby cohort. We've got an urgent care connected data system, and then a system-wide connected data system in Bradford, as well as cohort studies in the mental health theme. So there's all sorts of interesting data and infrastructure, and with that comes sort of skills and experience of using it. So you can think of us as a bit of a place to think about that as well. I'll jump onto the implementation and change in practice one just briefly. I've mentioned it through the Improvement Academy, but really, you know, that's the end goal, isn't it? You know, of course we need to do the research, and we need to know that we're doing things that are the right things to do, but we are always moving towards that implementation and change in practice. That's the goal of what we're doing. We're doing research to improve things, and in order to improve things, we need to know how to implement them. We need to know how to influence and change practice. So that's a really important thing that sits across everything that we do. And then I'll come back to that blue one, because part of it is this sort of bubble in the bottom, which has become more and more mentioned, I'd say, in the last couple of years, particularly from NIHR, this idea of knowledge mobilization and exchange. Not really very keen on the term, and I think it's you know, it's something that is a sort of age old. It's making sure we're telling people what we're doing. It's making sure we're building strong relationships and collaborations with people, so that we're able to hear from people, whether that's services, communities, about what the important issues are, so that we're able to direct our research in that way. And also that we've got those relationships, so that when we've found something, we can go back to people and say, hey, you know, you asked that question, this is the answer. What shall we do next? How do we move it on? So it's that two-way conversation, that knowledge mobilization piece. And if anyone's got a nicer way to describe that, I'd really appreciate it, because I don't know why it sounds so strange in clinical knowledge mobilization, when it's really, to me, much more grounded in relationships, trust, collaboration, and, you know, just sharing what we know. So I've talked quite a lot from a sort of abstract perspective, I suppose, and I just wanted to share a couple of examples of projects just to try and show you the different levels that we might work at. Just keeping an eye on the time. I'll do this within about 5 minutes or so we've got plenty of time. So this is the first example that I wanted to show you. So this project, this is a screen grab of our website, and there's a section on the website called Making a Difference, and there's lots of these impact case studies on there. At the end, I've got a whole page with links and QR codes for you, so you'll be able to access them that way. But yeah, don't be frantically reading. I know it's not the nicest slide to look at. But yeah, this is about how our older people with frailty team worked to lead the identification and management of frailty. So this grew out of clinical practice, really, and academic literature. So Andy Clegg, who is the theme lead for older people with frailty, is an older age consultant. So he works in the hospital clinically and was constantly struck by this idea of frailty and understanding, of course, that frailty was a driving factor in how well somebody recovered or how well somebody was able to tolerate a particular treatment. GPs have all of that information at their fingertips, even though they might not be aware of it, around what frailty, the factors around frailty. And if we can predict who frailty in a sort of measurable way, then everybody can have a score which can help inform the right care that people receive, receiving things that are right for them at the right point in time. So Andy led this project, worked with industry partners, worked with GP practices and NHS trusts, as in hospital trusts, to really develop this idea. And basically what grew out of it was the Electronic Frailty Index. So what this does is it sort of sucks in all of the data, all of the relevant data, and that relevant data was identified through good quality research practice and academic literature. What are the factors that are important for frailty? How can we take that in and provide a score, and how do we then make sure that score is appropriate? And that was what the research focused around. And it's now national guidance. So it's now within all GP electronic patient records, that you don't have to do anything. It just calculates in the background and pops up. So at a glance, you've got this consistency of assessment of frailty, which we know is a really important factor. You've got that figure up there. Older people living with frailty account for around £6 billion of annual NHS expenditure. So it's a really, a really huge issue for the NHS budget, but also for people living with frailty. They want to receive the right care and get that get the tailored support that they need in order to manage it. So yeah, it's national guidance now. So that means that it's benefiting everybody. It's benefiting, from a practitioner perspective, but most importantly, it's benefiting all of the patients that are being used. And I can't remember what the exact measure was, but there was a many millions number of how many people's EFI score had been calculated. But we don't just stand still. I was mentioning that sort of innovative method. It's not like, okay, that's that job done, off we go and we'll do something else. We're now developing the second iteration of EFI2, where we're taking that original index, but improving it by including new frailty-related outcomes that either we're now collecting and we weren't. We're trying to think about sort of weighted variables, so taking account of some variables that are maybe more important in your overall score compared to others, and then including more mental health outcomes in the modelling that were absent in the original plan. So that's an example of a big, large project involving data, involving industry, involving partners, and that's now in national guidance that grew out of our region. I've then gone right down to an individual example of a project. This is Holly Henderson, who's one of our PhD students. So she joined us, Holly joined us at the beginning of this ARC round and has spent 3 years with us working on her PhD, which looked at how to best support practitioners, commissioners and service providers to use connected data in order to make decisions about early life and maternity care. So here, this is, very focused, targeted individual support that has led to somebody's academic career taking off. Holly now works with us as a research fellow within the Baby Network. So it's investing in people that then stay in the region, that then they don't need to stay in our region. But they're staying in research practice that they then contribute to applied health research more generally. And then the last one I wanted to cover, I could have picked out loads given that we've got, like, say, 296, but I chose this one because it's a bit different as well. And you'll soon see that I found myself a QR code generator when I was putting this together. So there are so many QR codes, but this QR code takes you to the Born and Bred in Network's website. So lots of you will have heard of the Born and Bred in Network. I recognise lots of names from as you were all popping in. But the Born and Bred in Network is a really nice example, I think, of an YHARC project which has grown naturally. So it started as part of the Born in Bradford programme. So Born in Bradford, massive cohort study, a traditional cohort study. That means that, researchers are going into maternity practice, asking women who are pregnant, do you want to join our study? Can we follow you up forever? Please fill in all of these questionnaires. Can I take a sample of this and that? And then following up over time. But one of the really important ways to follow people up has been linking to their routine data. So routine data is things like your GP record, your health visitor record, your maternity record, dental, schools, local authority, all sorts of things. Anything that you receive as a public service will have some data associated with it. So we wanted to link this data together for people as an ongoing process for the mum and for the baby, and embed that into standard practice. So you've got a bit of a cohort for every generation. And we wanted to do it at place level. So we started it in Bradford, and it was really well received by both practitioners and participants. But then other areas started to hear about it and said, oh, we'd quite like to do something like that. So here we've got at the top the Baby Leeds team. We've got in the middle with the yellow sign, the orange sign, the Baby Wakefield team, and at the bottom the Baby Doncaster team. On the right, we've got a baby. It's actually my baby who's part of the Baby Network. So also populating cohorts as well as running them. And then we've got a participant from the original Bradford baby here. And this is it sort of epitomizes a lot of what we were saying in that that diagram. So we've got this co-production, people saying, actually, this is what we want and need, building a partnership locally to say this would be really important for us, then coming to us and we support them with communities of practice, training slides, resources, all of that kind of stuff, so that people can set up their own. Rather than us doing it, people are generating that knowledge and skills to do it themselves, which makes it much more sustainable and fairer. So then other people can go out and and leverage external funding to support their own research at place level. You've got that connected data infrastructure, sharing all that knowledge, but also generating it in our places so that we've got that for our region. The knowledge mobilization, obviously, part of that was relationship based. Through those collaborations, people heard about it, wanted to do more about it, and then we were sharing all of that. And the implementation and change piece is really in what we're doing with that data. So building these local based collaborations mean that you've got all the right people around the table to be saying, I think we should be using the research for this. Setting research priorities is a really key part of it. We should be using the research for this locally. How do we do that? Right, we'll do that. Right, where's the information from that? Right, how are we going to actually apply that? So it's almost like a mini YHARC in itself, the Baby Network. And there's so many more examples I could talk to you about. So they're sort of 3 project-based things. I just wanted to cover sort of just highlight the sort of wrap around functions. That sounds a bit rubbish, but I mean the things that we do more generally that support research across the region. So PPIE or involving our communities is a huge focus, as I mentioned earlier on. I've copied a few bits and pieces out here. So we've got on the top right hand corner a quote from a particular project about how they felt involved at a project level. So we do embed PPIE within projects, but we've also got leadership from our PPIE leadership and support group, the PSLG. PLSG, should I say? And the QR code on the screen just takes you to our webpage, so you can find out more about it. And Christine Smith has been leading that work as our engagement lead. And we do all sorts of different things within that supports more generally the idea of PPIE across our region. So there was a lunch and learn about why do we need to think about equality impact assessments. So you can go and find that there. It's embedded in the slides. It's on our YouTube channel. But we also offer things like free resources, which are on the website. And then at the bottom here, there's a link if anyone's interested. Oh, sorry, the QR code is a link to that, I think. There's a link at the bottom there which says ticket source booking, and this is a free training session that we run. It's a 2-day training course about an introduction to PPIE, and you'd all be really welcome to apply to do that. If you're not already a member or a partner of the YHARC, just get in touch with us and ask about how you can do that, and then you'd be able to receive that. It's a face-to-face training event over 2 days. They're not consecutive days, and it's been designed to be appropriate for people who are lay members of the public, as well as researchers and services who are interested in learning more about PPIE. So please do make use of that. I think we've got about 18 spots, I think, free on the next one that's coming up in March. So yeah, get cracking if you're interested in that. And then the other thing I've talked about, oh gosh, it's going to try and play this video. Hang on. There we go. And then the other thing I've sort of mentioned here, I've sort of covered it a lot already, is about this learning and development, a really strong flavour throughout. So Sam Debbage is our academic career development lead. Sam is Director of Research and Education at Doncaster and Bassett Law Teaching Hospital. But these are all of the different things that we do from a learning and development perspective. So there's drop-in advice clinics. So if you want some advice on a research method or on implementation science, for example, we'll have these clinics. There's mentorship opportunities available. We do seminars and conferences. And again, you'll find out all about these if you are a member and sign up to the newsletter. And the final thing, and this is a lovely picture of our executive team and our theme managers. So there's lots of us there. Thinking about how you can get involved. There's all sorts of ways to do it. So that really light touch ways, you can access our resources. So we put lots of resources on our website. You can join a group that, if you're a public member, you can think about how that, whether there's any PPIE groups that you might be interested in joining. If you're a clinician or a commissioner or a practitioner, there might be, and you're particularly interested in, let's say, children's dental health, we can put you in touch with groups that you might be able to learn more from or contribute to as a sort of a multi-sector group. Or we've got implementation groups, there's a frailty oversight group, there's all sorts of different groups. So if you want to get more involved in research and be a part of it, then we've probably got something that we can put you in touch with. If you're interested in finding out about academic career development opportunities, either as an individual or as an organisation, we can help you sort of navigate that. And then we do collaborate on funding applications or projects. We're not a funding organisation, so we don't have funding to give out. But what we do is we have to set out our expectations and projects to NIHR as part of the application process. But we do also try to be as responsive as possible to system or community priorities. So if there's a particular project that you've got that you think this is fantastic, it's a real need, get in touch with us. So if you think, can we evaluate it together, for example, or can we help you to talk about it more or spread the information and findings? Either if we can't sort of bring that within our existing work, we'll work together to collaborate on applications or leverage the funding in other ways if it aligns with the sort of theme areas that I talked about. You can also get involved in setting research questions or priorities. That's a sort of ongoing process, and you'll see that if you subscribe to our newsletter, which is next, or follow us on X or LinkedIn. And then we've got a YouTube channel as well, which you can subscribe to, and then all of these recordings go on there. But there's also other things like our implementation science snapshots, so you can do little bits of training about that. On podcasts, our essential implementation podcast series, there's all sorts of stuff. So That's a few options for getting involved. And then these are our contacts. So if you want to get in touch with anybody from any of these particular areas, I've put the email address here. These are our lovely theme managers that are attached to the specific projects, themes. And then there's a couple of more general ones there. Look, there's YHARC at BTHFT for general inquiries and PPIE. So, do make use of them if you'd like to get in touch. And then finally, I've put a few different QR codes there for the different bits that I've talked about. So do subscribe to our newsletter. There's our YHARC website there, our YouTube channel, and then there's some national information about what YHARCs are at the top there, if you're interested more generally nationally. And I think that's it.
That's great. Thank you, Sally. I've also put the links to all those things in the chat. So you've got the newsletter sign up, the YouTube, our YHARC website, and we've got a new website coming soon. So the new website will have searchable publications and resources and all kinds of things on there. So, and we'll let everyone know when that's ready. And we've also got the link to our Lunch and Learn programme. So we've still got some time now for some questions. So if you've got a question for Sally, either put it in the chat, or if you do use the little raise your hand thingy bob, which no one can ever seem to find, and I'll try and keep a track of who put the hand up first or wrote it in the chat first. If anyone's got any questions. We will also send the slides round, and I'll also send a little evaluation form with some more information in there as well, if you could fill that out.
Thanks,
I'm just
Claire.
having a look to see whether there's any. And someone also put in the chat as well that their team at York Trials Unit have just had their PPIE training that you spoke about, Sally, and it was really useful.
Oh, fantastic.
So,
that's great. Well done to Christine and the team. It's a brilliant training session.
And what I'll try and do is put that in the chat as well, the link to that one, if I can find it. That's actually, I think that's on our ticket source, isn't it?
Mm-hmm.
Yeah, I'll find it and I'll put it on. Thank you. So Sarah has put, who would be the best person to contact to discuss PhD funding opportunities, please?
So I think in the first instance, if you're very welcome to get in touch with me. We don't have individual PhD funding opportunities, but we'll support you in identifying them.
Right.
So the NIHR Academy, I don't know if you've come across the NIHR Academy. I should put that in the chat as well. Support a whole pathway of academic career development from sort of pre-reg and undergraduate to then pre-doctoral fellowships, doctoral fellowships, postdoctoral fellowships. There's a whole range, and we can, work with you to identify those. Does that help, Sarah, or were you thinking of something else?
No, no, I was wanting to apply for the DCAF opportunity when it comes out. Well, I'm kind of debating between that or whether I've got I'm just thinking about a few options, but it might just be helpful to speak to someone about the options really. And
you're really welcome to. There's also on the Lunch and Learn, if you go on the YouTube channel, Anne-Marie Keenan, who is I'm going to get her title wrong now. She's the Vice Dean of the NIHR Academy, I think. And she did a Lunch and Learn recently about different opportunities. So you might want to have a look at that one. That was a really useful sort of whistle stop, because the NIHR Academy is huge. And so they try really hard to make it nice and clear, but it's just so difficult to navigate because there's so many opportunities there. Really happy to help navigate that, and also to put you in touch with interested academics that you might want to link up with.
Oh, lovely. So I'll get in touch with you in the first instance, and shall I, Sally? Yes, thank you.
Lovely, thank you. So the next person's put their hand up was Viv.
Hi, Sally. Thank you for that. It's been really, really interesting and cut it down nicely. You put your bid in, and that was a few years ago. So, and you want to stay kind of moving on all the time. And you mentioned about, you've got your four themes, but what happens in the meantime of something? So, for instance, we've had COVID, and you might find that Bradford have, got this kind of hot spot of something going on in their area. after you put your bids in,
Yeah.
that's to be sorted. So can you kind of expand or change your themes, or do you find a way around it? What do you do?
Yeah, it's a really good question. So COVID was, I suppose, so so spectacular, I suppose, in terms of its impact, that NIHR actually asked us to shift our attention and focus to that. So across the whole ARCs, everybody did different pieces of work around COVID-19. So in Bradford, we did something called CSAG, which was the COVID-19 Scientific Advisory Group, where we got everybody together. So it was basically like a mini ARC for COVID in Bradford, and it was identifying priorities from the communities and from practitioners, but also really practical and pragmatic things from local authority colleagues, and model and then applying innovative methods like bed modelling and things, and sharing that with colleagues across the region. So we do have an ability to be sort of responsive. It's just, no one's just sitting there sort of twiddling their thumbs waiting for a research project, I guess is what I'm saying. And then NIHR is certainly not going to be giving research funding to people that don't have strong ideas about what they're going to do with it. So it's a bit of a tricky balance. But really, I'd say what we tend to do more is focus on leveraging external funding. So, if somebody comes to us with a really great idea, we'll say, right, let's think about how can we make this work? Have we got any funding within our organisation already to work on something? So MEX a nice example, Viv. So MEX, the Maternal Enhanced Critical Care Network, it aligns really strongly with some of our early life and prevention theme work. And so if there's a little bit of resource within that theme, then we can steer that towards it. So we are able to pick up additional pieces of work. It's just maybe not, we wouldn't be able to start a whole cancer work theme, for example. But if you were interested in that, we'd put you in touch with the guys in Manchester ARC who are doing that. So we're all friends.
That's great. Thank you.
Okay.
Thanks, Viv. And then next hand up, we've got Adoa Parker.
Hi.
Hi.
Hello, I find the talk really interesting. So I am funded currently by the NIHR on a 10-year advanced fellowship. And
Fantastic.
the idea is to look at using implementation science to improve the way that the researchers, trialists, improve recruitment of and retention of trial participants. So my project's a little bit unusual in that I'm not focusing. I'm focusing on professional behaviour, which I guess implementation science tends to do as well. What I wasn't quite clear on is, so I've already got the funding, is how much capacity, or if there was any capacity for an existing project that's going on to perhaps have a collaboration from yourselves to try and do the research in the best way possible. So I've got collaborators, but they're not based in the UK. So I was just particularly interested in whether you have capacity to work with an existing project from the implementation aspects of things.
Yeah, we do. We do that. There's another sort of slide that I have, which I haven't shared today, which is a bit like a sort of matrix. It's sort of like free to everybody, if you like. Okay. And that's things like these lunch and learns, the newsletter, the resources. Then there's maybe some sort of bespoke or tailored support. So that might be, supporting mentorship around PhD opportunities, or it might be if there's a common project that is important for the system, and that's the key to it. I think it's making sure that what we're doing always goes back to the priorities of the system, because what we don't want to be doing is research that interests us as individuals that isn't relevant to the system, because then that's just not the right use for the funding. But if it ties in, then we might be able to offer some tailored support. If it's more bespoke, and really specific and requires 2 days a week of somebody for a year, then that's where we'd be looking at leveraging that external funding. But if you've got a need around implementation, if you get in touch with the ARC inbox, which is YHARC, YHARC at bthft.nhs.uk, and then we'll pass you on to the right person if you just give us a little bit of information.
Sure. That's wonderful. That's really helpful. I enjoyed the talk, so thank you.
Thank you. I saw a question. Sorry, I know you're sharing.
No, it's fine. Don't worry. There was a question in the chat actually saying thank you very much. And they'd like to speak to someone to talk about the research opportunity whilst working within a substance use service and offering them therapy. Is there a person I could contact? So I've replied to say we've got obviously the generic email, and we can forward that on unless anything else you want to add, Sally.
No, I mean, I think, off the top of my head, I don't know if Versha, you want to say anything about it, but off the top of my head, that would sit within our mental and physical multimorbidity theme. We do a little bit of work on substance use.
Sure. Thanks a lot. That email, I have saved it, so I'll contact them. So I noticed that I work for the mental health service, Leeds NHS, so I didn't see our logo on there. So it might be something that we could speak about using this email, because there's a lot of opportunities, and so within the substance misuse service, really. So we were just looking at some research that we could generate and whether other people were doing similar work. So we have got different professionals working, ranging from midwives to health visitors to psychiatrists, etc. And I am a CBT psychotherapist. So I think it's kind of getting some helpful information and research going on from our service, whether other people were doing the same, rather than reinventing. Get in touch with people and then take it from there.
Sure, yeah, please do get in touch, and we'll like I say, we sort of think of ourselves as a bit of like the sort of the glue and the convener. So we might not know the answer ourselves, but we will try and put you in touch with the people that do.
Right. Thank you so much.
Okay.
Thanks very much. There was a message as well from Kerry, just saying thank you. And she's a new appointed Partnership and Engagement Officer for AGM Wheelchair Services in Hull East Riding. She'd love to learn more about the potential of research and groups, and very much like to bring our co-production and community vision to life. So Kerry, if you have a look at all our resources on the website and get in touch if there's anything that you want to know about that, that's brilliant. And Jane's interested in the PPIE training. Jane, if you missed the link, we'll send the slides around, so don't worry, or just send us an email and we can forward that on. We've got one from Sue. So Sue works at Get Out More Base in Keighley, and we've secured funding to launch our nature hub at Cliff Castle. Their work will be based around the town in various green spaces, working with all ages, looking at connecting people with nature and the communities for wellbeing. We're interested to know if there is someone who could work with us to help with that project.
Do you mean to evaluate that project, Sue, or to capture learning from it?
Well, possibly both. It's all very new to me, this is quite a full and informative session. So yes, just really trying to find out what is available and, and how you would be able to work with us on that.
So we've got a particular theme within early life and prevention, which is around healthy bodies, which is around physical activity. We've got a lot of play-based projects. There's something called Jump, which is Join Us, Move, Play.
We are connected to those.
Great. And Push, which is Play in Urban Spaces. So, and my colleague actually, who leads both of those things, is sitting right opposite me. So if you were to email the generic inbox, I could pass you on to my colleague, who's another Sally. And then, sometimes it's just about connecting you into the individuals who are doing that similar work, isn't it? That you can connect in and then think about how we can work together. But yeah, please do get in touch, and we'll put you in contact.
Thank you.
You're welcome.
That's lovely. Thank you, Sue. So I think that's all the hands and all the questions, Sally. So thanks very much. Like I said to everyone, we'll send all the information around and all the links, but please do just get in touch if you need anything, and we can funnel your request that way. But thank you so much for joining us today.
Thanks, everybody.